About you, I'm sick to death of hearing about saving the NHS and all of that sort of stuff. I tell you why, and I can be blunt with you because we're friends and you'll understand this. Recently, I went with a friend to the hospital. A friend of a certain age, I might point out, because he just wanted somebody to go with him. Nothing wrong with that. And when I'm free, I like to help people. That's the deal, isn't it? It doesn't matter. Anyway, we turn up at this particular hospital at the designated time. Now, let me just point out, we'd had to get a cab to go to this hospital, which had cost them, a fair amount of money. And this was all agreed, and we were chased by text and everything about don't forget your appointment, blah, blah, blah. So we turn up at the hospital and we're there about, 20 minutes. Suddenly it's half an hour later. So I go up and I say, what's happening, and then there was a bit of an embarrassment. And suddenly it turns out that the actual physician had forgotten the appointment. She was at another hospital. And so consequently, no, she couldn't come back. So could this person now come back, which meant another cab fare back and then another cab fare and another cab fare back. Remember, they're on pension money. You get the picture. Now, what was interesting about this was no apology or anything like that. It's just, just happened. So a few days later, I was with another colleague who's had a terrible time health-wise recently. And I was in the hospital with them. And what was fascinating was, even they are from another country, they've lived here for about 30 years now, but very much got an accent, the sort of thing. Now, what we noticed was this: the moment that these people turned up to the hospital en masse, the sort of people I mean, that come with a translator. They actually have all of these people now at vast expense in the NHS as translators. They were seen first, not just once, numerous times, to the point where this particular situation escalated, and this particular lady was asked in front of me, well, couldn't she pay for it herself as she was in a full-time job? She pointed out that that job was teetering on the brink and possibly not. So we sat back, and hours this poor lady waited, let me tell you. And what was fascinating to think was, like me, I pay heavily in my taxes to support the NHS. I can't get a doctor, I can't see anybody in a hospital, can't get a dentist. But seemingly, if you've got an interpreter and you get a little bit aggressive and turn up with the whole family en masse, muttering really loudly, you'll get to see through, and more importantly, get to see a doctor. It's also fascinating to note, isn't it, that while all of these people basically claim they're so hard worked and strapped, the moment this MP basically said she voted in favour of a political stance for this Birmingham doctor, who's also part of our government currently, she got through faster than anybody else. You see how this system is truly broken, but it's not in favour of those that are actually giving money to try and save it. Anybody else agree? Neil Sean in the very heart of London.